Dr. Bajpai Sahab and Dr. Lingaya Garu and my Dr. Rajgopal Raju and then the other dignitaries on the dais and off the dais. I'm really grateful for all your affection for sparing your valuable time in attending this session. For this session, we also requested our President, Sri Abhijat Sir. Unfortunately, he could not make it because of the sudden demise of his father. So we all paid our condolences, and through this association, we'll send our condolences to him, to the bereaved family, for the deceased to be rest in peace. And today, the main purpose of this is to see that we do something which will make useful, much helpful to all this, our medical fraternity on one side, and to the national board, which with we are closely associated. Frankly speaking, they have given a lot of importance to the UNBI, and with the introduction of Dr. Bajpai to the NBE, the proximity has become much more. His friendly nature, and on one side has grown the board to the greater heights, and also made us to speak to him without any fear and getting our things done easily, which otherwise would not have happened. Because I'm there for the last 15 years in this Anbai, and I'm seeing day to day that the improvement that has been made in the board, and special thanks to Dr. Bajpai sir and Sri Dr. Abhijat Seth. Both were instrumental and helping, and they have given a lot of importance this particular unit of the AP and Telangana by encouraging us to conduct such programs which are useful for the students, for the faculty, and in a way to the board also. I was once holding presidentship for this unit, but the necessity was felt, and then people above asked me to take over as National Alumni Coordinator. So I thought, first I think I should tell the existence, why this alumni has come. Those were the days when there was a lot of disparity between now of course it is not there, it is slowly coming down, between the medical colleges and the national board, the DNBs. There was stepmotherly treatment towards the DNBs, and they were also looked down by the MCA. We were all loggerheads, and under those circumstances, and we had many dreams and the desires which were justified to be fulfilled by the national board was also not in a position to help us. So we thought we should have greater strength. So I felt that the greater strength will only come from our people who have passed out and then who are staying as alumni. And if all people are taken into our fold, I think you can do better. So with that concept, this association was started, and then since then there's no looking back. And successfully this is the third time we are conducting, of course with the cooperation of all the passed out candidates. But the only thing is how to improve the membership. So naturally people, they come for the meeting and then they go back. Only face presentation and bridge presentation. So which may not be helpful many times. So we thought ideas come that why not we make all the third year, final year, outgoing students to be made members. So the onus, the responsibility lies on you all people to see that those students who are leaving, you make them compulsory the members of this alumni, so that it will be useful for them in future, and then also to the board. The main idea of starting this institute is, this association is to help the board as well as to the passed out candidates, and then those who are going to pass out. This is the main idea, and then which I think slowly we will fill over a period of time with the help of Dr. Bajpai. So I got some points. I'll just briefly go through. I will not take your time. And what is that in my mind? How to improve this and how to seek your cooperation in future. there should be, our idea was to show placement. At this juncture, I will tell that the moment you pass out, don't think that you have conquered everything and you can straight away go for practice and all that. My advice to all of you is join somewhere, some institute, somewhere at least for some time, some period, so that you will be definitely, naturally, with your experience, you can do better. At the same time, you can also become, you will also get the eligibility of becoming a faculty member in an institute. Naturally, if you are just passed out and then you have no other qualification, you will not be taken as a staff member also. So I request you, all of you, to see that straight away going to the practice, because passing out is something and then practicing and learning the tricks and all that is different. So which everybody requires. So my advice is, please see that you also join the institute. Why I'm telling this interest is also, the institutes, most of the times, the recognition is rejected based on the lack of staff. This is, many times they say that you are understaffed. So the NBA also can take all the people who are passed out candidates, and then they can also direct them to attend a particular institution through Alumni Association, or they themselves can direct, so that they will get a placement in the particular institute of their choice. So that is an idea that has crept into me, and then I also request Dr. Bajpayee to keep this in mind. And so many areas where the alumni, the passed out candidates can find a place is, you can have research wings. Say there, you can ask them to, like a ICMR, and then the board also in future can think of having a research wing where you can also induct those people. And the question banks are made. The people who have got experience, they will be asked to prepare question papers. So you can identify also from among them some of these to make the question banks. And then to central examinations, I also suggest examination centers. Say, for example, in Hyderabad, you can choose 2 to 3 centers, and then the examination should only be conducted there. These alumni can also take your help, and then instead of going to each institute for asking for them to conduct the exam, find out examination center in each city are there. There won't be any problem for you to get the cases, because every institute can pool their patients, and then you can also request the medical college. You should instruct them. You should see that the medical colleges also help us in sending the cases, because otherwise we are finding it difficult to get the examination cases. So they don't want to give because with the loggerhead problem. So that also we can overcome. And then the biodata and then CV should be made available to all the to the alumni and to the board, so that as and when required, you can be given opportunity to get the placement. And then otherwise in these research areas or in examination for teaching also, and some fellowships are also there. So they can also suggest, and we can also suggest the fellowship. Please, I request all of you to register yourself and see those coordinators who have attended. See that you make many people the members, and then ask them to tell the benefits of associating themselves, joining them this institution, this association. And my request to you is, because once for all, or once in a time, or at least frequently, we should all meet. Otherwise, we'll become like a frog in a well. So we don't know what is happening in the next world and what is happening there. So you all should come out, exchange views and see that how best we can help ourselves, at the same time helping the national board. So I'll try to meet you. You also see that you contact me, and then we'll also contact the national board in case of problems, because he has given us I should say that he has encouraged us by approaching him frequently. I don't think it is a lenience, but definitely it is his nicety that he is allowing us to approach him. And so many medical colleges are cropping up. See, even in this state, 20 medical colleges, and most of them are understaffed. So you can make also, we can also show you the places where you can join also. That's also an important place. So a lot of opportunities, avenues are there for all of the alumni to I'm thankful to Bajpayee Sahab. He told that over a period of time, there will only be a single degree and there are no two. So naturally, then we will not have any heartburn or the discrepancy between this. So if once that comes, I think most of our problems will be solved. Then it has been discussed that examination, the way the MD, MS are allowed to appear for DNB. Similarly, the DNBs are also to appear, should be allowed to appear for the MD exams. So in a way, that will serve the purpose of ego in both areas. Why not? Hum kisi se kam nahi. So this, with that attitude, I think our problems will be solved. I think there are a lot of problems which have already been discussed. I will not take much. Speakers are there to speak. And then I once again thank you for those, those who have come from a long way. And then they are really my inspiration. And then I feel that you are all my strength. We'll continue to meet, see that what we can do for ourselves and to the board, we should definitely do. Thank you, sir.